Hey guys, come along with me today to do some lip filler. As you can see, this patient has a really good base that we are filling. I have my back-filled 31 gauge needles that I am using. And right now I'm just going in with a little bit of standard volume technique to border the outside of that vermilion border, just to create a crisp border so then I can go back in and fill the body of the lip. Like we always tell you in our courses that we teach, it's very important that you're pushing low and slow. So make sure that you find a nice pressure as you're retrograding out of that tissue. I always like to explain it as leaving spaghetti noodles of filler in the lip rather than meatballs. We never want to bolus in the lip. So as you can see, I just created that border. Now I'm going in that mid body of the lip, angling that tip of the needle up towards that Cupid's bow, and again, retrograding filler until I am satisfied with it. Here I am fanning, so I'm not coming all the way out of the tissue, and I am changing the direction of my needle, so I save my patient a poke here. I like to use a Q-tip to assist me in wiping away blood, just allowing myself to pull the tissue or that lip taut with that Q-tip so my finger's nowhere near that needle. Maintaining your safety is also important while injecting. In order to give her some more vertical height in her lip, we are inserting in at that vermilion border and inserting in at a 90-degree angle and doing retrogrades vertically. This is going to pull up the height of the lip so she gets a little bit more vertical show throughout her lip. I like to stay on the inside of that vermilion border just because you're poking and penetrating the border of that vermilion border, and I never want that filler to have a reason to seep through that border. So I like to still stay in that lip on the inside of that vermilion border when I'm doing this technique, but it's still giving her a nice, natural, beautiful height to her lip. And on the other side, we're going to repeat the same process. So I'm once again bordering the lip, pushing a low and slow retrograde out of the tissue. I usually fill a couple different backfilled syringes just to make sure I have enough product to put everywhere. I never like to put all of the filler in the lips in one setting just because obviously you get some swelling and bruising. So typically my style of what I like to do is aim for about a half a syringe, give or take, in the first sitting, send my patients home and tell them that your homework for the next 2 weeks is to be constructive about what you like about them, what you would change about them, whether that's size, whether that's proportion of the top lip to the bottom lip. I want my patients to come back and feel comfortable to tell me what they would change about their lips, because at the end of the day, I have to like them because it's my work, but they have to live with them. So always ask and make sure that you have a clear communication with your patient of what their actual end goal is. It's super important just because everyone's lip goals are different. So here we are injecting the bottom. We're doing that same standard volume technique throughout. I like to, again, create a nice crisp border, and then from there, kind of let my aesthetic eye take me where it wants to fill. So creating that nice crisp border here, always make sure that you're injecting all the way to the corners of the lip. I know you're not supposed to inject laterally. You're not supposed to inject too much filler laterally because what happens is you'll get a sausage appearance of the lip. But if you're modest with it and you're tapering little to no product lateral, you're going to get a good result. One of my biggest pet peeves is when I see someone smile really big and you can see all of that filler in the mid of their lip, but not toward the lateral aspect. You want to be able to blend that filler out so it's not noticeable that a patient has filler and that it looks comprehensive throughout. Here I am injecting the tubercles of the bottom lip. This is where the volume should be focused on the bottom lip. That's where you want more volume overall. So I'm injecting 90-degree angle just to give her a little bit more vertical show in that area and also focusing a volume in that area. As a provider, it's my job to assess the lips and overall have a communication with my patient of what they're going for. It's always important to assess the end goal of the patient, but also to assess the patient at baseline. So I typically like to ask my patient what side of their face they like to sleep on. A lot of the times the patient is going to be volume deficit on the side that they sleep on just because that's the side that they are using more often and flattening out. So typically, that's going to be the side that I start on because there's going to be less volume in that area. Not always, but 9 out of 10 times it is true. So just assess little things like that and little asymmetries so you know where you're starting and how much product to place in each of these areas. I always like to taper out the corners. Like I said, it's very much a pet peeve of mine when you can literally see the patient smile and see that filler drop off. So I am placing a smidge of filler in these corners just to taper so it looks comprehensive throughout. I'm not really placing for volume, just to kind of blend those corners. Overall, my job though, when I'm done, or when I think I'm done, is to go back through, have my patient make different expressions. Those lips should look good at baseline, but they should also look great when they're animating and expressing. So really take the time to walk through that, have your patient smile, have your patient do different animations so you can see the comprehensive look of that filler. I always have my patient smile probably a million times before I call it quits, just so I can reassess and perfect everything. Fine tuning is completely normal. I am also the type of provider who likes to go through and give my patient a nice massage of those lips afterwards, just so I can assess what's bruising, what's swelling, so I can point out to them if they're feeling any lumpies and bumpies when they leave my chair. It's more than likely injection swelling and not actual filler. Important to educate them though that they are not to go home and massage their lips like this. This is only for a provider. So please educate them. Afterwards, I'm putting a nice balm on there. This balm has essential oils and arnica in it for bruising and swelling. Keeping those lips hydrated and clean is going to be very important for post-care. No massaging and no excessive lip activity is also going to be included in the post-care. So please educate your patients for best results.